Greetings. Today we commence our study of Chapter 7, Assessment of Self-Care Abilities Part 3. I am your presenter, Tan Yukin. This chapter will focus on 3 key self-care assessment areas related to elimination. 1. Urinary continence assessment. 2. Bowel continence assessment. 3. Toileting ability evaluation. We commence with the first component, urinary continence assessment. Within the self-care assessment framework, urinary continence refers to the physiological capacity to regulate normal micturition. The assessment must account for instances of incontinence, unsanitary voiding behaviors, and inappropriate manipulation of urine. Core assessment parameters: voluntary bladder control capacity, frequency of incontinence episodes, and the need for assistance and level of dependency when using absorbent products such as adult diapers. The assessment employs a standardized 4-point scale for complete control. 0 total incontinence, primarily utilizing structured interview techniques. During the assessment, the following polite inquiries may be utilized. Grandfather or grandmother, when you feel the urge to urinate, can you maintain continence until reaching the restroom facility? Alternatively, have you experienced any instances of urinary leakage in your garments? Or are you able to independently manage absorbent products such as incontinence pads or adult briefs? Grading criteria: score 4, complete diurnal and nocturnal control 4 to 6 daytime voids, 0 to 2 nocturnal voids without incontinence. Score 3, preserved daytime control with compromised nocturnal function is less than or equal to 1 weekly incontinence episode or independent use of absorbent products. Score 2, occasional daytime incontinence, less than 1 daily but more than 1 per week, with deteriorated nighttime control or requires minimal assistance with absorbent products. Score 1, frequent daytime incontinence is greater than or equal to 1 daily, without complete loss of control, with nocturnal incontinence, or requires substantial assistance with absorbent products. Score 0, complete incontinence or indwelling catheterization. Special considerations for urinary continence assessment. Comprehensive interviews must be conducted with the individual family members and caregivers. Assessment should integrate on-site observation with actual conditions documented over the preceding week. The following special circumstances require formal documentation. Case 1. When incontinence episodes approximately 2 to 3 times weekly result from communication barriers such as mild dementia. A score of May 2nd be assigned with detailed documentation. Case 2. If incontinence is medication-induced, complete pharmacological records must be maintained, including drug name, administration schedule, and dosage. We now proceed to the second evaluative domain, bowel continence assessment. Bowel continence refers to the physiological capacity to regulate normal defecation. Some older adults may experience constipation, fecal incontinence, unsanitary defecation, or even fecal manipulation. Systematic assessment and corresponding care interventions can effectively prevent these occurrences. Key clinical definitions: fecal incontinence, the involuntary passage of stool beyond conscious control. Constipation characterized by hardened stools, difficult evacuation, and reduced frequency, fewer than 3 times weekly. Assessment consideration: voluntary bowel control capability, frequency of constipation or incontinence episodes, and assistance requirements when using assistive products, for example, glycerin suppositories. Standardized scoring criteria for bowel continence assessment, interview-based protocol. Polite inquiries, grandfather or grandmother, when you need to defecate, can you hold your bowel movement until you reach the bathroom? Have you experienced episodes of fecal soiling in your garments? Do you experience difficulty with stool evacuation despite the urge? Have you used enema devices independently? Grading criteria score 4. Complete voluntary control with appropriate defecation localization, absent constipation or incontinence. Note: individuals with ostomies demonstrating unimpaired elimination and independent pouch management qualify for this rating. Score 3. Occasional constipation or incontinence is less than or equal to 1 weekly episode, or independent use of assistive products, glycerin, suppositories, protective pads. Score 2. Frequent constipation or incontinence, less than 1 daily but more than 1 per week, or requires minimal assistance with products, for example pad orientation identification. Score 1. Persistent constipation or incontinence is greater than or equal to 1 daily without complete loss of control, or requires substantial assistance with products, for example enema administration. Score 0. Severe constipation or complete incontinence requiring dependent care for elimination or dermal hygiene. Assessment protocol: conduct comprehensive interviews with the individual family members and care providers. Perform integrated assessment by combining on-site observations with actual performance over the past week. Special circumstances documentation. Case 1. Mobility impaired individuals with preserved awareness but frequent incontinence due to delayed toilet access. Score 3 with documentation. Case 2. Chronic constipation requiring weekly manual disimpaction with dependent hygiene care. Score 0 with documentation. Case 3. Medication-induced fecal incontinence requires complete pharmacologic documentation. We now examine the final domain toileting ability assessment. Toileting encompasses the complete sequence of recognizing elimination urges, utilizing toilet facilities or bedpans, assuming, positioning, performing hygiene measures, rising from the fixture, and completing post-elimination sanitation. Assessment: focus capacity for independent task completion throughout the entire sequence, degree of required assistance. The assessment employs standardized interview-based scoring criteria. Assessment protocol inquiries. Are you able to manage your lower garments independently during toileting? Can you assume a squat or sit-down position without assistance? Do you require support when rising from the toilet? Do you maintain independent recall of post-elimination sanitation procedures? Grading criteria score 4. Complete independence may utilize assistive devices throughout the entire sequence, disrobing, elimination, cleansing, rising, redressing, and flushing. Score 3 requires verbal guidance only, for example, flushing reminders. Score 2 needs minimal physical assistance, for example, stabilization during transfers. Score 1 requires substantial physical support while maintaining cooperation, for example, independent positioning but dependent hygiene or rising. Score 0 complete physical dependence with non-collaborative behavior. Assessment consideration: toilet fixture type squat or commode excluded from assessment. Ostomy or catheter users or absorbent product users qualify for score 4 with demonstrated independence. Special circumstances documentation. Case 1. individuals with preserved cognitive capacity but requiring physical assistance due to mobility limitations during conscious states may be assigned a score of 2 with detailed documentation. Case 2. Ostomy patients capable of independent stoma bag preparation but requiring assistance with post-elimination hygiene maintenance may receive a score of 2, accompanied by comprehensive recording. Case 3. Patients undergoing renal replacement therapy without voluntary micturition function qualify for a score of 4 with appropriate clinical annotation. A case analysis assignment is hereby assigned for post-session completion, requiring systematic application of the assessment methodologies delineated in this module. This concludes the formal presentation of this chapter's content. Thank you for your attention.